Organ transplant patients have had their lives transformed by calcineurin inhibitors, which effectively reduce acute rejection rates and increase survival. But many do not realize that these drugs significantly increase the incidence of skin cancer as an unwanted side effect. For long-term immune-suppressed patients, skin cancers often occur more frequently, develop earlier in life, and progress more rapidly to advanced disease. Treating skin cancers in transplant patients represents a significant clinical challenge. These patients have compromised T-cell function, and mainstream immunotherapies often lead to transplant rejection. We are developing a new medication which can be applied to the skin at sites of early disease. This medication will help prevent harmful skin cancers developing in organ transplant patients. Our approach reactivates local T-cell function by antagonizing Tacrolimus, the most commonly prescribed calcineurin inhibitor. We show that our lead compound, Q2361, rescues T-cell function in the presence of Tacrolimus by antagonizing the interaction between Tacrolimus and its target, FKBP12. We also show that Q2361 rescues T-cell function in the presence of two other mainstream immunosuppressive drugs, sirolimus and everolimus, by the same mechanism. Administering Q2361 into tumors growing in Tacrolimus-suppressed mice led to tumor regression in the presence of Tacrolimus. An analysis of regressing tumors showed that T-cells within tumors were activated and could produce effector molecules like interferon gamma, TNF-alpha, granzyme B, and perforin. Q2361 did not affect tumor growth in mice with depleted T-cells, demonstrating that Q2361's mechanism of action is via reactivating T-cells. Finally, when applied to the skin, Q2361 achieved high and sustained residence with negligible exposure in the blood. Our findings demonstrate applying Q2361 locally permits T-cells to activate, driving tumor rejection when Tacrolimus is present. Our data suggests that topically applied Q2361 has great potential for reactivating T-cells in the skin alone. These findings represent a promising strategy to prevent or treat skin cancers in immunosuppressed organ transplant recipients without leading to transplant rejection. Organ transplant patients trapped between the need for immunosuppression and the lethality of associated malignant skin disorders stand to benefit the most from this potentially life-changing research.